Hello, my name is Dr. Robert Clyde, and today, by the title of this video, we are going to be talking about the Ligma disease. Now, the Ligma disease has sort of taken the world by storm. Around 7.5 million people have succumbed to the disease. The National Organization of Health has even stated that if the Ligma disease keeps on going on like this, it will most likely surpass the Spanish flu that killed around 15% of the population back in 1918. In fact, 15 states have already declared that they have run out of coffins due to this disease. As we speak, around 25,000 people per minute are dying to this disease. So many people are wondering, what is Ligma? Now, the first reports of Ligma happened back in September of 2017 in Africa. Now, the National Organization of Health had stated at the time that Ligma was a sexually transmitted disease that affects the testicles. Now, this disease has mutated into a different disease in which it affects organs and limbs, special organs such as the heart, the liver, and the kidney. Now, many people, due to this, cannot have a heart transplant or a liver or a kidney transplant due to how rapid the disease rapidly kills the body. Not only has the Ligma disease had turned into a sexually transmitted disease and then turned and mutated into a liver and organ and limb disease, but it's also gone into an airborne disease, which means that the Ligma disease is in the air as we speak. Now, this is a miasma theory in which diseases go through bad air, and that's how they're caused. Now, this is a very popular theory back in the 1850s, and when cholera was a very big epidemic. It was soon proven wrong, but this seems like the most likely thing. So that means that if it's an airborne disease, not everybody is affected by the disease, and no one is safe from this disease, and that we have no protection from it. Many people as old as 90 have been killed by this disease, and no one is even safe if they're even young. In fact, around 50,000 infant babies in Oklahoma have succumbed to this disease, which is a very big threat, which means, and it proves, that this is most likely an airborne disease and that nobody is safe from it. Now, many people are probably wondering, are more people prone to getting this disease than other people? And my hypothesis that I've been writing from here, as you can see, is a very big mess, that people that are circumcised are more likely to get this disease. In Israel, which is more predominantly Jewish, almost half of the population have been inflicted by this disease. And in the Jewish culture, it's a mandatory to have their baby, if it's a male baby, to be circumcised. But not only men are being affected, but women are also being affected as well. It's not just a male disease. But if you are circumcised, you are most likely more prone to getting this disease. Now, many of you people are probably wondering, is there a cure? Now, there's not a cure yet for this disease, but many scientists in Oklahoma and in Texas have been working on a cure, but that most likely will not happen for a number of years. The death toll is rising, and there's no way to prevent the disease, no matter young, old, female, or male. No one is safe from this disease at this point. Now, you're most likely asking, what are the symptoms for the Ligma disease? Now, although many are sketchy and sort of disputed in the scientific community, many people, including myself, have listed the symptoms that are the most common. These are headache, stomach aches, and a rash on your private parts. There have also been some cases in which people have had bubbly sort of substances on their private parts as well. There's also been a whole lot of statistics that are showing that if you have diarrhea, vomiting, and loss of a headache, such as nausea and or migraines, that could also be a sign. But the most likely are the headache, the stomach aches, and rashes on your private parts. That is the most likely symptoms for this disease, or in which the most common of which. But with these different signs of symptoms, many scientists and doctors are now coming up with the theory that maybe Ligma has multiple diseases to it, such as cancer. You have kidney and liver cancer, and then brain cancer. So there might be multiple Ligmas in our bodies. There might be multiple of Ligma diseases with different symptoms. And maybe there might be a totally different disease entirely. Anyway, my name has been Robert Clyde, Dr. Robert Clyde, I should say. And for Ninja out there, Ligma balls.